Hi, my name is McKenna Petty. Imagine one day you are able to do the simple task as brushing your teeth and combing your hair, and the next day you are not. Physical therapists and occupational therapists are able to help you get back to your sense of normal. Chances are, if you never went to an occupational therapist or had someone you know did, then you do not know all what consists of it and what they do. However, one day you might have to encounter one even if you don't want to. According to a New Zealand study by Cohn and Wilson, occupational therapists use engagement in occupations to promote wellness and therapy to enable a living and meaningful life. Today I will discuss what an occupational therapist does, briefly discuss the differences between an occupational therapist and a physical therapist, and tell you about my personal experiences shadowing an OT. So I will begin with what an occupational therapist does. According to OT Potential, an occupational therapist treats injured, ill, or disabled patients through therapeutic use of everyday activities. They help these patients develop, recover, improve, as well as maintain skills needed for daily life. It also states that occupational therapy has been found to be the only spending category associated with reducing hospital readmissions. According to the Anatomy of Education of Occupational Therapy curricula by Catherine Schofield, the study of human anatomy is an integral component in the education of future occupational therapists. There are many different settings you can find in OT, such as hospitals, schools, outpatient clinics, home health, nursing homes, etc. OTs can basically be found anywhere a nurse can be found. Everyone's occupational therapy will look different. It just depends on what your occupation is. Like a child, their occupation is playing games. Next, I will discuss the differences between occupational therapy and physical therapy. I honestly did not know the differences between occupational therapy and physical therapy until I did personal research as well as shadowing. According to OT Potential, the main difference between occupational therapy and physical therapy is occupational therapy focuses on improving daily life, and PT focuses on improving body movements. OT focuses on a person getting back to their occupation, while physical therapy is getting someone back their physical strength. According to a study done by the Development of Everyday Occupations of Children with Cerebral Palsy, the greatest role of occupational therapy and physical therapy is given the development of high morality and functioning of hands, self-service skills, increased activity and participation of patients, social functioning, and quality of life. One is not better than the other, it just depends on the patient's needs. Next, I will tell you about my personal experiences shadowing occupational therapy. Like I said, there are different types of occupational therapy depending on the setting and the age. I had a personal experiences shadowing occupational therapies in elementary schools, hospitals, and outpatient clinics. In an elementary school, I worked with kids with autism. They helped with their fine motor skills, and they played a lot of games. Clothespins like this are an example of what was done at occupational therapy for kids with autism, such as being able to use the pinching mechanism instead of just grasping as a whole. At a hospital, I shadowed an OT that specialized in lymphedema, which is extreme swelling of legs or arms. There we did a lot of wrapping of their legs to make the swelling go down. And then at the outpatient clinic, I was in the pediatric center again and did a lot of kids with like autism or other disabilities. And I think my personal favorite thing about OT is the many different settings you can experience with just one job. In closing, we are now all aware of what OT is, the difference between occupational and physical therapy, and my personal experiences shadowing. I want to leave you with a quote about an OT I once saw on a t-shirt. Medicine adds days to life, but occupational therapy adds life to days.
Ow!